Now let's take a look at how health insurance companies and managed care organizations restrict or attempt to control how much healthcare and medicines their members use. This process of controlling healthcare use is called utilization management. There are many different studies conducted on how best to encourage people to use just the right amount of healthcare. The goal is always better health for the most efficient cost. People who specialize in utilization management spend their time trying to figure out how to motivate people to go to the doctor when they're sick, get their preventative tests and checkups, take their medicine when they need to, and they try to think of ways to make sure people don't overuse the system. For example, seeing an expensive specialist when they could have gone to their primary care doctor for their flu shot. All this is kind of just helping make sure that they are using the system effectively. They also spend a lot of time figuring out how to help people take generic medications versus high-priced branded products. So in our work as advertising pharmaceutical professionals, it's that last one about the generic use of drugs that we usually run up against. The utilization management techniques that are used to curb brand use are therefore the focus of this section. It's just important to understand them. So by the end of this section, you're going to be able to understand moral hazard and its role in health plan management, identify the difference between copay and coinsurance, define how step edits and prior authorizations affect branded prescription adoption, select the strategies that effectively help patients overcome control barriers put in place by health plans, understand how deductibles work for both medical and drug benefit plans, know what disease management is and how it differs from wellness programs. Let's get started. So the first concept that we want to go over is the concept of moral hazard. It's really important to understand this. Insurance companies spend a lot of time trying to estimate this concept, and so it's important to understand what it is. Now, the best illustration of moral hazard that I've ever found is in the Friends television show, and I've included a link as part of your materials for this lesson. In one of the episodes, Joey loses his health insurance. Do you remember that one? He got a hernia and had to walk around town doubled over in pain until he could get an acting job, which would get him reinstated in the actors union and therefore back on the union's health plan. At the end of the episode, Monica walks into the apartment to see Phoebe with a baseball bat about to hit Joey over the head. Joey's wearing a batting helmet. Monica is shocked and asks, "What are you doing?" And Phoebe replied, "It's okay. Joey got his insurance back." Monica shrugs and picks up a second bat to hit Joey with, and that's the end of the episode. Big laugh. So that's the concept of moral hazard in action. Moral hazard is the theory that if you give people health insurance where they don't have to pay anything or very much of anything for their care, they make riskier decisions than if they were not on health insurance. So this theory is true up to a point. Sure, people go to the doctor more quickly if they believe or think that it's free versus if they had to pay full price. But often when patients have to pay full price for a doctor's visits, that swings too far in the opposite direction and they end up being sicker due to waiting longer to see a physician. So the trick and the entire discipline of benefit plan design is to give patients just enough benefits to make going to the doctor easy when they're sick, but not too easy or free that they go for the smallest ache and pain. One of the ways health plans control for moral hazard is to put some low-level barriers in place, just to make getting care a little bit more work. We'll learn about these and how they impact our ability to encourage patients to stay on branded medications. Next, we're going to take a look at patient liability a little deeper. And so we're going to review the kind of payment designs within the health plans that they use. And so these are design elements that affect how patients can afford medications. So the first is the deductible. There's often a medical deductible, which means that the patient or the member has to pay a certain dollar amount before the health plan starts to pick up any costs. So this deductible is waived for preventative care like checkups. As an example, let's assume a patient has a $500 deductible for their plan. They go to the doctor for a checkup, and to encourage these preventive visits, the plan waives the deductible. So the patient only pays a small copay for that visit. Now, when a deductible is waived, it's important to remember that the patient doesn't have to pay the deductible, but the amount they do pay, that small copay, doesn't get counted toward their deductible. The cost the patients pay themselves is called out-of-pocket. Most plans have out-of-pocket maximum amounts, which means that for every year there is a patient, each year the patient would have to pay out of their own pocket a maximum amount. So let's say over the course of the year, the patient pays their $500 deductible, and then coinsurance payments for certain medical care like the birth of a child. Once they reach the out-of-pocket maximum amount, let's say in this case it's $3,600 for that year, they would pay nothing for the rest of the year. Now, sometimes copays for drugs are included in this out-of-pocket max and sometimes they're not. The last way a patient pays for care is what we've already discussed, copays and coinsurance. Copays are the actual dollar amount payments and coinsurance is a percentage of the cost. Often there are copays for care at a physician or provider that is within the health plan's network and coinsurance required for care that's delivered outside of the network or out of network. One important aspect of patient liability is that was included in all health plans prior to the passage of the Affordable Care Act was the lifetime max. These were limits to what the health plan would pay for patients in the course of their relationship. And these limits were high, about $1 million, and while that cost may seem like you'd never reach it, patients diagnosed with certain cancers or babies that were born early and required intensive neonatal care in the hospital easily reached those dollar amounts with their care. And the people who sometimes struggled with bankruptcy due to the high medical costs were sometimes caught by these lifetime maximum limits. And the insurance just stopped paying because they'd met that lifetime max. So after the ACA was passed, this maximum limit is no longer allowed, and millions of people are safer from medical bankruptcy. Next, we have the strategies for encouraging access to branded treatments. There are several strategies that pharma marketers use to get patients access to their medications and help them afford new branded treatments. These strategies are important to you to know about as their advertising partner. So vouchers are usually offered as a way to provide patients with a free trial to get a single or starter dose of a new branded medication. They're typically delivered through the physician's office and encourage physicians to write trial prescriptions for patients who are appropriate. Though these are fairly straightforward programs and kind of feature one and done. Copay cards offer an easy way for patients to lower the amount they pay for their medications over time. Usually offered by the brand, the card works by buying down the cost of the drug. So let's say a particular drug is available on Tier 4 of the health plan formulary because it's a branded medication and relatively new. The cost to the patient is $50 per prescription. The patient registers for a copay card offered by the brand and pays a low fee, maybe as low as $10, and then the drug company pays an amount that is enough to cover the remainder of the patient's portion, in this case, $40. Then the plan picks up the cost for the remainder of the medication. As you can see, copay cards encourage patients to use branded medications and basically create a loophole through the cost barrier that the plan tried to set up by putting the brand at Tier 4. More patients get the branded treatment, and the plan has to pay for more patients to be on this medication. So sometimes the brand will put the branded treatment at a high patient cost, for example, $150. The patient takes their copay card into the pharmacy, pays their $10, then the pharmacy sends the claim through the system and it immediately gets payment from the pharma company for the rest, but the pharma company has set a limit to how much they're going to pay for each prescription. This is called a back-end cap, and that amount in this case is $100. So the pharma company contributes $100, the patient has just paid $10, so someone needs to pay another $40 before the health plan will pick up the cost. So what happens? Well, the pharmacist goes back to the patient and asks for another $40. So now the patient has paid $50 for a prescription they thought would only be $10 because they had a copay card. The fine print on the back of the card or in the terms and conditions will state this clearly, but patients don't read the fine print. They're left feeling like they've been tricked. So you need to help your clients create messages around these programs that are critical to the success of these efforts. It's important to understand where these programs will have the most effect. Some states like California restrict the use of copay cards. California does not allow copay cards to be used for medications that already have a generic equivalent. So your media targeting strategy can also benefit from knowing more about these programs. Another way pharmaceutical brands help patients is through services which can get them onto branded treatment faster and manage higher costs. In many patient support programs, there are bridge payment programs that offer to pay for the medication for a certain period of time. These services are intended to help patients get their medications and start taking them while they're waiting for their insurance to be approved, maybe the prior approval process, for instance. Patients can also ask for help filling out forms and working with their insurance companies. Most brands offer these types of programs. Promoting these offerings are important and sometimes challenging since the materials for registration are often only in the doctor's office or as a page on a website. Working with your clients to include information about support programs and email messages, display ads, and websites you are creating can help get patients connected with these services. A couple of other ways brands work to make medications available and affordable are by using specialty pharmacies and telemedicine. A specialty pharmacy is a separate pharmacy that fulfills drugs and are usually injectable or rare or unique in some way. The specialty pharmacy often works with doctors and hospitals, so the payment for the drug goes through the medical claim process versus the drug benefit claim process. What this means is that the drug costs are often covered at a higher rate, and the patient pays little or nothing for all of their medication. Oncology drugs are usually fulfilled through specialty pharmacies versus retail. Some health plans have started offering specialty pharmacy benefits in an attempt to put more controls on these medications. But in most cases, the drugs that are fulfilled through specialty pharmacies are paid for through the medical benefit at little to no cost to the patient. Telemedicine is growing in its use by pharma and gets patients access to treatments. Instead of waiting weeks to get to see their physician or a specialist, patients can call a physician on the phone, pay a small fee, usually less than $100, and talk to a trained physician. Then the physician, if they believe the patient needs the medication, will call the prescription into the patient's retail pharmacy or mail order pharmacy that will deliver the patient's prescription to their door. This process usually includes a report delivered back to the patient's primary care physician just to let them know what's been going on, but sometimes it doesn't happen. So there are concerns about the way the pharma might use telemedicine to make access to care easier, but they're going to be circumventing the controls health plans have tried to put in place. However, the use of telemedicine is growing, and one of the major offers of telemedicine are the health plans themselves. So in that case, the health plan would be offering an opportunity to talk to a doctor and restricting the prescriptions that would be written by that physician to those that are on the medical formulary. As the use of telemedicine grows, so will the way that brands use it to help patients get their medications. The next thing we'll talk about is disease management and wellness programs. And these are two important ways that health plans kind of try to manage the costs of patients that might need additional help. Disease management programs are provided for the sickest patients. The health plan will usually identify a patient due to their claims data. They'll get flagged in the system of having seen a lot of specialists or just gone to the hospital. And these programs are usually staffed with physicians and nurses that will reach out to the patient, usually over the phone, and help them manage their care and get them the help they need. The patient, once they're alerted or flagged in the health plan system, it gets assigned to someone. So, let's say someone has a heart attack and is taken to the hospital, the health plan will notice that claim coming through and assign the patient to a disease manager. The disease manager will engage with the patient and start helping them as they return to health. Disease managers will remind the patient about going back for their follow-up appointments, make sure they're filling and taking their prescriptions, and accessing other services they may need, like Meals on Wheels and other types of programs. Wellness programs, however, are usually designed for certain employer groups and the health plan. They are offered to members at the workplace and online. So members can create their own custom programs that may include exercise management, weight gain, or weight loss, control, diet, support for smoking cessation, depression, other types of services. Having access to these services help patients get the care they need with the support of their health plan, which is also help speed the payment or give patients access to programs at zero cost. So, for example, many smoking cessation programs offer prescription smoking cessation treatment at zero cost to patients who are enrolled in these programs. This concludes our discussion about utilization management. Hopefully, you've gained a greater appreciation for the ways in which your clients have to navigate the challenges to get patients access to their treatments and make them affordable. As you can see, I've included a lot of readings for more information about all of these different types of controls, especially copay cards and some of the other techniques. So in the next lesson, we're going to finish up with an overview of Medicare and Medicaid, two programs that offer affordable medication for millions of Americans, and with the aging population in America, are incredibly important for you to understand as you help your brands with their marketing.